We are in a unique position as a state to really bring together the things that we would like to achieve in primary care, and so I think we need to keep on remembering that very exciting thing. So I would like to just begin, as I begin every presentation, an important meeting with an acknowledgement of the traditional owners of the land. I would like to thank Aunty Teresa for her really important and moving conversation this morning. It really made me think of my mum, who was having babies at exactly the same time, and as we know, having a very different experience in accessing care. And as the chappie from the Grattan Institute always says, it's really important to remember that acknowledgement of country is not a mere collection of words, but it is an ongoing recognition of the disparities in health outcomes. So I'll put this random slide up just to prove that Health Consumers Council, we actually supported the work in this, because I do go to quite a few workshops and I'm thinking, now what was that workshop again? So there it was. So we were partners in one of the workshops to talk, as we pulled apart the idea of commissioning. And so I just randomly put that up there. So I think, I went back and had a look at that. As mentioned, I do go to quite a few workshops. So I went back to the report and I sort of pulled out, the stuff that you hear, strong consumer engagement and participation in all elements of the commissioning cycle, but especially in the design and contracting of services is critical. So that was awesome. And, I guess sometimes I'm a fairly unpopular speaking guest because I always sort of try and highlight that documents say one thing and reality can say another, and that's I think that tension and that's that vision that we have. We know that this is not happening necessarily across the board, and we know that that's the vision of WAPHA, and it's very exciting that we continue to aim towards that vision and that consumers should be at the centre of commissioning. So as I was sort of inspired by rereading the report, I just gave it a little tweak to the diagram so maybe Richard and Leanne and Anne might want to do a second version. You can put in one like this. So essentially, yes, it was a little bit of a witticism, but it's that sort of thing. It absolutely changes the way you look at everything when you put the person at the centre. What happens when you're running an organisation, and I know that very well. I've been running a not-for-profit organisation for probably about 8 years in my life so far, and it's hideously difficult, and it's much harder than running a for-profit organisation, and you're constantly pulled by the needs of the service. But whilst that is the natural impulse, like many natural impulses, it needs to be overcome, and we need to reorient always and ever our thinking around commissioning to the people that we are here to support. And you can't go wrong. So some of the work I've been thinking, over the last, some of you may be aware that I was actually on the panel of the Sustainable Health Review as a consumer. So I sort of can't whinge about the report because, I can't go they did that because I was one of the they. But lots of the thinking we did around how do you engage differently. This diagram I thought was really interesting. It was talking about that fixes that fail. So there's a community concern and then people go, right, there's a concern, let's go away and fix it. We'll come back, we'll say this is how it needs to be done. And then because there hasn't been people taken along for the journey, the fixes don't work. So it's really about that process of if there's a community concern, how can you go through that complex and difficult process of getting people across the issues and really understanding where it is you're coming from. And perhaps the Labor government is thinking about that at the moment. But yes, it is a long and complex process, so we need to factor that in. I don't know if any of you have heard of School for Change Agents, apart from Claire. So School for Change Agents is a program that's run by NHS Edge, and it's run every year. It's a free program, and it's really just designed to get people thinking about, thinking and reflecting on the work we want to do. As we know, it is relatively straightforward. Not relatively straightforward, but so much of our energy does go into creating documents, creating, reviews and recommendations and models of care and so forth, but actually making them work, as we know, is really difficult. So one of the first things that happens is that people don't want to do whatever the policy says. And so School for Change Agents talks about this idea of when do you actually engage? And again, it's that the human instinct is to go, I've got a problem, let me go away and find some solutions and give you 3, because otherwise it's going to be too hard. But what they say, what the challenge is share the problem as early as you can. think differently on how you engage. So this is sometimes, I would just say, how consumers feel. You know, in a way, we are quite ready and we would really like to be part of the conversation. After all, it is our bodies, it is our health, it is our life, it is our tax dollars. We would quite like to be at the table. So we're a little bit like that dog. However, I think sometimes, just sometimes, and I have experienced it just occasionally, we might be experienced a bit like this. And I think, you know, there is that difficulty in how the consumer feels about wanting to engage and how the service feels about wanting to be engaged. I mean, after all, I've just taken my pen to Leon's document and changed the graphic on it. There is that sense of when you engage, you may have had a plan, and then after you talk to people, that plan's got to change. You've got to go back to the graphic design. I'm not suggesting you have to, Leon, but, you know, you get the idea. So there is that sense of, you know, we had an idea and that idea has been disrupted. However, the disruption of the idea might lead to a service that really does turn the curve. So James was talking about the Sustainable Health Review recommendations, and I thought I would just supplement his a little bit by really honing in on the ones that super excited me. So they were all around the ones that were about, that actually sat under the first, what's it called again? Enduring strategy. Whatever, yeah, then the recommendations sit under that. So whilst I think there's a really important look at the how much we invest in preventative health, I think, you know, I think there was a really important flavour all through the Sustainable Health Review, and it's been discussed many times this morning, that the issues we're trying to solve cannot just be found in medical, and clinical answers are not going to cut it. This quote is from a nursing memoir, and quite frankly, I'm a bit of a health nerd. I have lots and lots of books on my Kindle that are written, but I love the ones by doctors who've left the building and they just start telling all the dirty secrets. But there are very few nursing memoirs, and I think that's just something. I'm not sure about social work memoirs either, Leon, so it's, you know, just something to think about. But I do think there's something in that space of people reflecting on their practice, and this particular nurse, you know, was reflecting on how often the people that presented to the emergency department where she worked were there because they were hungry and tired and cold and bereaved and all sorts of things that the system doesn't help with. I've put this up too. This is a pictorial representation of adverse childhood experiences. So the Health Consumers Council did some work last year with the Obesity Collaborative. What we were really hoping to achieve in that was I guess in some ways a bit of a disruption on the way things have already been done. I think, for example, most people probably know that they need to eat less and exercise more in order to lose weight. And in fact, it's not that they don't have enough information, it's that there are a range of other issues that are getting in the way. And the Adverse Childhood Experience tool, I'm not sure if any of you are familiar with it, but it emanated from an obesity clinic. So that's how I found out about it during that project. And so it talks about these different things around abuse, neglect and household dysfunction. And the short answer to this is it's a very simple self-administered tool. And I've heard it being described as the screening tool that we're just going to have to continue to understand the importance of. It's more important than bowel screening and what do you call those things, pap smears and so forth, and probably less unpleasant. But so this is basically a self-administered tool, and anyone with 4 or more of these is going to have a range of challenges that others don't have. We don't get to start at the same part of the race. So I think it's just one of the opportunities that we think is to, again, to disrupt the thinking. So there is a sort of a fledgling movement called ACE Aware WA. If any of you are interested, there is a Facebook page, and talk to me about it afterwards. But it's something that really drives trauma-informed care. So trauma-informed care is one of those slip-off-the-tongue phrases that's very hard to deliver and doesn't happen, a bit like person-centred care. Slips off the tongue, but it doesn't always happen. I also really like to reference this. I know many of you in the room are familiar with this, but this research around 100 families that started from New Zealand and started from somebody who'd been in the sector for so many, many years, and really her vision was 100 people over a year and having an interview once a fortnight. And it found she had lots of researchers saying, what about 20 families over 6 weeks so we can bash it out quicker. So she hung out until she found the researchers that would take her through that journey. And interestingly, the question they asked was, what have you been doing in the previous 2 weeks? They didn't say, what services have you tried to access? But what that question uncovered was how many services of many different varieties of government and non-government and charitable and all over the show, that they were trying to get the services they want, and it was kind of a full-time job. So there's this disconnect, and I personally believe that disconnect comes from when the person is not at the centre. What often happens is, well, my funding doesn't cover that, so can't help you. So it's not about having the person at the centre, it's about having the organisation's need and the funding streams as the dominant narrative. So anyway, back to the Sustainable Health Review and exciting new ways forward. So this one about committing to new approaches to support citizen and community partnership in the design, delivery and evaluation of sustainable health and social care services and reported outcomes. That is obviously, again, that's just music to our ears. What is that going to look like? That is something I'd really love to think that everybody in the room thinks, I would like to be part of this picture of why and how this happens. So we're just in the early stages of forming a collaborative of consumer and carer organisations to really say, we want to really in some ways be the what's the word, reflecting back to the system, how well are these implementations, how well are these recommendations being implemented? Do they really fit the, have they been done, have they not been done? So it's almost like this recommendation watch group. From a consumer and carer perspective, are we getting there? So, I guess there's lots and lots of ideas. There's lots and lots of ideas around engagement, but at the heart, it's that concept of a more deliberative approach. I've already talked about when do you engage. The answer is as soon as possible. And who do you engage? You engage in as many ways, as many people as you can. Don't have the same health nerds like me at the table. Go a bit further, find out more, meet people where they are. So some of that concept around deliberative democracy, which is on that further column, the right-hand column, is trying to sort of indicate that if you spend more time with engagement, it does, for example, mean you need to inform people. Good Lord, is it really that time? Sorry. So you need to inform people of what it is you're trying to make decisions on in order for them to give useful feedback. And I think that concept of what can we do around random selection, what can we do to do something quite different from what we're doing now. And so all that sort of concept around deliberative democracy is that sort of underpinning principle. So these are some of the ideas. Obviously, the same sort of ideas of workshops and surveys and focus groups and so forth. But things like kitchen table discussions, things like I don't know if anyone's actually been following the work of Bayswater Futures, but it's not so much a citizens' jury approach, but it is a let's provide food and wine. Well, Minister for Health's not here, so we'll just leave the wine bit in there. But basically what you do is you get people coming to those events who would never go to a residents' association meeting, and you do give the people who don't come along to these things, they do come and they get involved. And what you get involved is practical projects, and what you get to see is ongoing iterative progress. And I think, WAPHA's talked a lot about this morning about how they developed, and I will, from an outside perspective, I've actually been sort of meeting with Leon every 2 months over that whole period, and I just watch it grow, and I was in awe of how the organisation developed. But I think WAPHA's right, you cannot know from the beginning how it's going to work. We all are in this together, and we all need to be able to fail if necessary, and we need to try things, and we need to make mistakes and get egg on our face, but we need to commit to doing an engagement in a really meaningful and effective way, because it does make all the difference in the services that we commission. So expansion of patient opinion. Some of you may be aware that I'm a huge fan of patient opinion. Its transparency has completely changed the game around patient feedback, and it's around a safety and quality conversation that, because it's conducted in the public eye, but it's conducted in a safe way, it has definitely changed everything. Some of you may also be aware that Care Opinion is a social care platform, which is very much the same. And my understanding is about this time next year, the two in Australia will be zhuzhed together as they are in the UK. And it becomes this way to constantly reflect back the services that, say, WAPHA has purchased, is it meeting need? It's that other way of continuing that safety and quality conversation. The people who are receiving the services need to have a say in how those services are working for them. So there's care opinion. Obviously, transparent public reporting, I think I may have already mentioned transparency, but really, say for example, the Hugo Massey-Taylor Safety and Quality Review, I found myself trying to do a recommendation page watch. Has this recommendation been implemented or not? And it was really, in a way, you just get lost in the weeds and you think, I don't know if it has or it hasn't. And interestingly enough, with the READ review, with the work that was done as part of the Sustainable Health Review to say, this is what got done out of the READ, it was actually really hard to get a consensus. Has this been done or has it not been done? And I think all the way along we want to think, what are we going to achieve out of all that work we put together? So as I say with the Hugo Massey-Taylor report, I think the really key thing is just to step back and say we just need to press ahead with the public reporting. And I know a lot of work is in that space, but that is one of those key principles, I think, that ensures that we get the sort of services we're looking for. So shared decision making is a key one. And I think it's getting that balance right between the individual conversations you're having with your patients and also with the people who are trying to create change in the system. Making the whole co-design a normal part of business. Community-based online approaches to better link people. Also, there's the community link booth, and I've got a little picture, and I would like to acknowledge Antonella Segro, whose vision it was to create a community link booth which addresses that concept of social prescribing and linking people to peer supports, so that when they're actually leaving a tertiary hospital, that they are thinking about other ways that other things that they need to keep themselves well. And we're having fun with that, aren't we, Antonella? And it's continuing to develop. And I think that the issue around carers is really important. But I would just finish on this point. A diet plan is not lost weight. I said this at the launch and I'm saying it again. So yes, we do have a report. Yes, we've got a really great and solid mandate, and we have a great opportunity as a state, and I would really like to think that that's something that you are interested in and will want to work with us, our lovely consumers, on co-design and turn it from this hyphenated word that gets thrown around into reality. Thank you.